guys, Dr. Christy Ennis. Today we are talking all things diastasis recti. Say that 10 times fast. So that's going to include what the heck it is besides a big mouthful. How do you know if you even have it? The exercises you really need to be doing right off the bat before any other exercises. And then what exercises might need to be modified a little bit so that you don't make things worse. So number one is, what the heck is this thing? Like I said, besides that big mouthful. So if you look at your tummy, you'll see you have two lines of muscle on the side here called your rectus abdominis muscles. They are joined in the center by the linea alba, which is a strong connective tissue, kind of giving force to that and holding things together. Now what happens when the stomach kind of overstretches is that connective tissue overstretches. Those muscles actually separate a little bit so that now you have a gap in the middle. And I'm going to show you how to know that too. So remember I said it's when the stomach overstretches. So a lot of times we think of that with pregnant women, right? Because what happens when you're pregnant, belly certainly expands. And you'll sometimes see a dark line where the linea alba is too, right? That's what that dark line is in pregnancy. But it isn't just in pregnant women. It's anybody that gets that stomach kind of expanding, like Santa Claus is a good example. I actually have some male patients with this too, and they had no idea what it was. I had one person tell me that he just has this little alien. And every time he goes to sit up, it goes, it doesn't really make that noise, but you'll notice that, right? You might be toned everywhere else, and then you just have this darn little bloop that doesn't go away. It may not even be fat. It might just be these darn muscles. So step one is trying to figure out, okay, might I have this? And that's what we're going to go over next. All right, let's test out whether we have that gap present. Now there is some debate as to what is actually considered technically a diastasis. Usually 2 centimeters or 2.5 centimeters, which tends to be about 2 fingers, unless you have really big fingers or really small fingers. But I usually use the 2-finger rule just as an easy way to do it. So you're going to start lying on your back. You're going to take those 2 fingers and you're going to place them this way on the tummy. And we're actually going to check, everybody says around the belly button, but when I had mine, it was actually up towards the rib cage. So you want to check in a few locations here. So I'm going to put my other hand behind my head and I'm going to do just a little bit of a partial sit-up, just partial. And so what you want to see is there a gap here? And you can see I've got about 1.5 fingers now, but as I move down, I don't actually have anything. This used to be 3 fingers, so it's gotten much, much better. Yay, and yours can too. But that's how you check. Easy peasy. All right, now that we've figured it out whether we have this issue or not, and if you're still watching this video, you probably have it, we're going to talk about the exercises that you really need to start with. Now there is some great debate in the literature because the literature, the research behind these things are not awesome. They're actually very small study sample sizes, and there's some methodology issues there a little bit, but promising new research actually shows that if we can stabilize some of that deeper core, really help us with that canister, it actually makes all of the other abdominal exercises and other exercises we do much less likely to cause any issue, and possibly, this is the kicker, right? It's just that possibly help us to close that separation. That's where the research is a little bit iffy on how well do exercises really help close that gap. Now, the other thing to keep in mind is that with these deeper exercises here, there's also a new kind of theory out that it's not just about let's close the gap. It's about how do we really get that tissue loaded to help out. So remember, it's that linea alba, right? That's kind of the issue there. And just like any other tissue, in order for it to actually get stronger and work again, it needs to have proper load to it. So using these deeper stabilizing muscles actually help to do that without stressing that rectus abdominis. So that in and of itself will give you a good base to start with. So let's start with the first thing first, which is going to be that deep abdominal or transverse abdominis muscle stabilization. First thing we want to do is really engage in those deeper abdominal muscles. So that means gently pulling in that belly button, but not moving the spine. So not tilting the hips, but just that little gentle belly button pull in, like you're kind of zipping things up a little bit. All right, now that we've activated those deep abdominal muscles, we're going to work on the diaphragm. And breathing is always good for us, right? But breathing properly is actually part of the core. And again, really helps that canister and pull things together. So it's a little bit opposite of how you probably normally breathe. When you breathe in, you actually want to fill the belly up. So it's breathe in and fill the belly up. And then let the belly go with that exhale, right? Trying not to get too much movement from the rib cage. So sometimes I'll have people place one hand on the rib cage and one hand on the belly. Just like that. Shoot for about 5 repetitions or so, and a lot of times doing this lying down first makes it a lot easier than going to do it sitting up. You're not having to fight gravity. So you can just be relaxed in your bed and doing these exercises. That last part of that deep core is going to be pelvic floor activation. And I will link a video on some pelvic floor exercises for you to take a look at too. But the basic gist of it is you're going to start with that abdominal breathing, right? So you fill that belly up. As you exhale, you're going to think about pulling right from the center down there, right up without lifting your butt, squeezing your legs, and holding your breath. Right? So it's really kind of that elevator where we're just kind of gently pulling up. All right, so you won't be able to see much except my belly, and that's how you know you're doing it right too. So it's breathe in. As I exhale, it's that little pull right from deep in the center. Just pause for a second or two, and then you're going to go let it go. Breathe in, exhale, pull in. This is a weird visual, and don't do this at home, but if you think about picturing a marble and they're kind of trying to pull a marble up and inside, that gives you the kind of the feel of what you want to do with that. So that's kind of your base. And then to make it a little bit more difficult, you're going to add some arm and leg movement to it. So you want to get the right breathing, hopefully the pelvic floor, pat your head, rub your belly, no, just kidding. But try to get all of those deeper stabilizing muscles going, keeping that activated, and then you're going to start with just a little march, which seems so super easy, but it's totally not when these muscles aren't activating properly. So you want to make sure as you're doing this, like I said, you're still breathing and that you are keeping everything nice and steady. You're not pushing out with those abs and your hips are not rocking. You can add a little arm movement in if it feels okay too. That makes it more difficult. And then kind of that last level, only if you can keep things steady and not push those abs out, is adding in the legs up. But this usually takes a little while before you can get to that point. All right, now that you've got that deep core working like it should, we're going to talk about some other exercises to either maybe avoid in the beginning or that you can go ahead and add in. Now, it was originally thought that you had to avoid things like planking and crunches and anything twisting because it would put too much pressure on those Batman muscles there in the abs. But what they are finding now is that if you can actually activate all of those deeper core system muscles, you can then go ahead, maybe with some modification, add some of those traditional ab exercises in and still help to close that gap. So yay, that's actually really good news. You don't have to avoid things for life. Now you do need to avoid those if you can't activate, right? So if I were to go and just get into a plank, my deep core isn't working, it's gonna put a ton of stress in through those front abdominal muscles, the rectus muscles, right? And what I'd probably end up feeling was pressure and maybe even a little bulging sensation. And if that's the case, and that is the case with any exercise, if you feel any of that, it's not the right thing for you, okay? So step one, get those deep core muscles activated. Then you can go ahead and, like I said, you might need to modify a little. So with the plank exercise, you can start on the wall, and again, making sure you're not pushing out. And if that feels too easy, then you gradually make it a little harder, right? And you get down onto a surface, whether it's a coffee table, and eventually you can make your way kind of onto your knees and then back up into your original position, making sure to add movement to that plank, which if you watch my plank video, you'll see why I always say that. Now, some other traditional exercises too, besides the abdominal ones that you want to think about, are really any general weightlifting exercises. So it is okay to lift weights, but again, you don't want to hold your breath so that you're increasing abdominal pressure in there. And you want to probably not start out with super heavy weights so that you're having to strain, right? Any straining, and that includes going to the bathroom, can actually make that a little worse. So when you're doing some things that you would normally do on a bench, like a bench press or a skull crusher, a lot of times I'll have people just get right down to the ground, bring their feet up, and then work on getting those deep abdominal muscles going, right? Just like the other ab exercises before you start. If you're on a bench, you certainly can bring your feet up onto that bench. I like the floor though because it actually helps your shoulder too. You can't go too far down. Lastly are some of those standing exercises. So again, I'd watch out for heavy, heavy weights to start until things are nice and strong. But a lot of times those bent over, right? Like the single leg, if you've got your one leg on a bench or something like that, you're gonna do much better not stressing here if you do kind of double leg, right? With a row or a reverse fly, or even a bit of a staggered stance so that you're not really just stressing one area and one side. And there you have it. Now you're gonna get more functional and feel way more comfortable.